My name is Chuck Lucor, President of St. Francis Hospital. I appreciate you all joining us today to celebrate Valentine's Day. You know, for me, Valentine's Day is focusing on those relationships that really shape our lives. You know, I can't think of a better way at St. Francis to celebrate by reuniting our patients and their physicians related to the care experiences that our patients had. We're grateful in a number of ways at St. Francis. We're grateful to our patients who chose to put their trust in St. Francis as a provider. And we're also grateful to our outstanding physicians who make St. Francis every day the best place to receive care, work, and practice medicine. So I think we're going to have a lot of fun today. And Jose, maybe you can kick it off by talking about your experience with John DiPietro, Dr. Germain, and Dr. Lundy.
I really don't know what happened as of, I'd say, on November of 2019, right up until February of 2020, because I had such bad, what do you call it, heart failure, that I had no clue what was going on in my life. And thank God for my wife deciding to bring me to St. Francis and getting me the help that I needed to keep me alive. I got to thank the team, all of you, for the work that you did and for keeping me alive and for implanting this unit inside my body that, thank God, has given me a new leaf on life. So I got to say thank you to everyone. And may God bless you all.
Rita?
Hello, everyone. Hope you're having a good morning. Jose, you've been nothing but a perfect example of what our program has to offer the community for advanced heart failure. Like you said, you had no idea when you woke up what happened to you. We really just had a rapport with your wife before we implanted your pump. And you've risen to the occasion. You obviously were surprised about what happened, but you recognized that you felt so much better that you could go forward with your life. And you've been an example of somebody who's listened to all the instructions that you needed to do, who's met patients that have gone through the process. And you are a really great person. And we're really happy that you're enjoying your life this past year.
Thank you.
Dr. Lundy?
Jose, you're what makes this all worth doing, okay? Like I said, you said thank you to us, but just seeing you like this is all the thanks we need. I don't have to speak it again. I say it all the time. We're truly a team, okay? And the reason we have the results we have, and Jose is the way he looks, is because of this team and everyone working together. So, as I said, oftentimes they stuff the microphone under my mouth, okay? But the team is really what makes the difference. John, Rita, whole team.
John, you want to say a few words?
You know, Jose, I remember when I showed you this pump the first time, and
Yes, go ahead, John.
You couldn't believe what, you know, your face looked like. You did what, you know, and explaining how, you know, this wire is going to hang out of your belly, and, you know, it all worked. You know, you learned what you needed to learn to take care of your own device, proving that this device could take someone who, you know, frankly is, you know, you didn't have that much time left. And by listening to our instructions and trusting the system and the hospital and the staff and the doctors, that, you know, this device really obviously, you know, has made a huge difference in your life. And, you know, it's, you know, when someone sees this device, they see, like, you know, and the batteries that go along with it, They just don't know how they would ever be able to handle it. So again, you're a perfect example how this works, and works for so many people if they have the trust in the healthcare system that that they come to. So we're glad that you came to St. Francis. Obviously, Terry and Kristen, the other bad coordinators, love working with you. Between you and your wife, that it's basically the picture of the perfect team that it takes to do this and take care of a person like you. So, like Dr. Lundy said, if this ever becomes wireless, you'd be my first candidate to call to put this in. If you ask me, because you're doing the right thing.
Thank you, John.
You're welcome.
Angela, would you like to share your experience with Dr. Petrosian and Dr. Chung?
Yes, I got a new lease on life. I worked until I was 81 years old, and I always thought it was the COPD. It was getting worse and worse and worse. And when I went to my doctor, he said, no, it's your heart. And with that, of course, everybody knows I know the family. All my family works in St. Francis. And Laura, my niece Laura, got the ball rolling. And I had Dr. Moyne, which was wonderful, Dr. Shaw. And then they put me in this study. And I said to my youngest son who works up at South Nassau, I said, what do you think? He said, well, if you don't do it, you're going to die, Ma. You got no other choice now. This is it. And I was very happy that I kept going for all these tests, and I was accepted into the program. And I was so concerned that I wouldn't be accepted. I was on oxygen 24/7. I couldn't walk out the door. And that was at the point where we had to do something. And I was so afraid of being in a nursing home because I only had boys. Not that they're any different. Yes, they are different than girls. Girls tend to take care. They care, but it's not the same. My son Eddie wanted me to move in. I wasn't moving in. And the rest is history. I feel wonderful. I babysit Eddie's kids. I mean, I could go out shopping. My grandson drove me, my oldest grandson drove me all over. And now we went back to Delaware. So I miss him. But I'm so thankful. Everybody in the whole team. I used to go there and usually say my name and my date of birth. Oh, we know who you are. We know who you are. And everybody cared about my progress. And I feel wonderful. Thank you, God. I really do. No oxygen. I have it in the house in case. My Dr. Saraceno wants me to keep it here in case. He said, I don't want you going to emergency. But so far, I'm good. I know my limitations. When I walk out of the driveway, my little granddaughter walks me out kind of the ice, but I'm able to walk.
Thank you,
God
Angela.
bless you all. God, my son wouldn't let me go anywhere else. And John knows my family. He knows my niece Laura and Joseph, my nephew, and Christopher, Laura's son, studied to be a doctor. And he says, you got to go there. That's where I went.
Angela, how old are you?
82.
Fantastic.
Wow.
I
Dr.
worked until I was 81. I sold jewelry at Macy's. My husband passed away 14 years ago. I was always independent. And my boys knew it, and they said, you would never ask for help. There's a time you have to start telling us. You just can't think you can do it yourself. You can't. But I'm blessed. The whole team. I love Fran. I love Megan. Megan didn't have a baby yet. So it became like a family. It's really important. Right down the line. And Dr. Shah is lovely too.
Thank you, Angela. Dr. Petrosian, you'd like to share a few words?
Sure. Thanks so much for the opportunity to be part of this exciting program. And I can't remember if it was Dr. Lundy or Dr. Germain talked about teamwork and trust. And I think Angela's care embodies all of that. She was under the care of the heart failure team. She had a device called a CardioMEMS that was implanted in her pulmonary artery to help monitor her fluid status, and that helped for a while, and then it wasn't enough, and then the heart failure team, referred her to us in the valve program and had the confidence in us to evaluate her for a research study for her tricuspid valve. And Angela was our first patient that we treated in the tricuspid clasp trial, and we got a wonderful result. She had torrential leakage of her tricuspid valve, and after 2 devices, there was essentially no leakage. And as she said, she was on oxygen around the clock. She had swelling of both her legs. She couldn't walk, and now she's off oxygen, looks great, feels great, and she's on 30% less diuretic than she was on before she had this, and it wasn't working at that point. So, I think we're excited to be able to offer the newest of technologies to our patients through our research programs. And Angela had the confidence to let us, try to help her. And I think we got as good a result as we could ever hope for. And so we're just, excited to have the ability to help care for our patients in this way.
I found that everybody, like you said, it's a team, and they were all amazing. If I got moved from one place to another, and even when I had gentlemen as male nurses, they were always respectful, because I'm still the old-fashioned grandma, and they always respected me, and they cared. They really, really cared. Then I find out, I motorcycled with your nephew. So, but everybody's been wonderful, and I like the follow-up. I feel that's important, to follow up, and I keep my appointments.
Angela, I was hoping you could share the story that you shared with me about the moment you walked into the backyard and your grandchildren saw you walking without any assistance. Can you share that story with everybody?
Yeah. Eddie put in the pool. That's Christine knows Ed. And he has the 2 boys. One was 4, one was 7, or he just turned 7. And I walked in the backyard without the cane and without Alex helping me down. And the little guy, 4 years old, he said, "Eddie, look at grandma. Look at grandma. She's walking by herself without a cane and without Alex. She's all by herself." And they were so happy. They're adorable. I mean, they even made like a bed for me downstairs, and the little guy brings me books because he says, "Grandma, I know you love to read." It's a very close family. The boys are wonderful, and Matea, the girl, she's a little princess. But they were so happy because they seen me one day. I passed out when Eddie was walking me to my car, and that stood in their mind. And I got a little prayer from the little guy, and he said, "Grandma, take the guardian angel with you. They'll watch you." So thank you all. I could enjoy my grandkids and my family. That's what life is about.
Angela,
Thank you.
Angela, I'm going to stay with you for a second. You mentioned you live in St. James out in Suffolk County, correct?
Mm-hmm.
How did you end up with the team at St. Francis?
Oh, well, my niece Laura, I went to Dr. Moyne, and I had that other device put in, and I, it's like that monitor. I lay on it every day, and if my vitals are off, they call me and tell me to take the extra diuretic or whatever. But then it had gotten so bad, and I went to Dr. Lee, I used to go to, and he was surprised I went to St. Francis. He said, "Why did you go to St. Francis? I could have done it for you." I said, "You never mentioned it, Dr. Lee." I said, "Number one, my niece works there, and when I have something done, I stay with my niece." And then Laura lives in Port Washington. She's the daughter I never had. Her mother was my first cousin. We married 2 brothers. And when I opened up my eyes and I saw Laura, I mean, it's a daughter. She's a daughter. Yeah. So that's why we're at St. Francis.
Greg, can I get in here? Because there's some people that need to be acknowledged. Rita Germain is one of the leading, she's talking about the cardiomems, and Rita Germain is one of the leading cardiomems people in the entire country. She has the largest implants registry and follows these people. And George has been so humble. You know, the TAVR clinic and the structural heart program at St. Francis is one of the largest in the country and has some of the very best results in the entire country, and has pushed the envelope and has been first in line with almost every new advancement with mitral valve stuff, with tricuspid valve stuff, with different. So, I mean, those two programs are among the very largest and best in the whole country, and we have them right here at St. Francis. Sheila is just a perfect example, okay, of what happens when you have that level of expertise and excellence at an institution.
Wonderful. Thank you, Dr. Lundy, for sharing that. Jose, I'd like to ask you a similar question that I asked Angela. You live on the South Shore of Suffolk County and ended up with the team at St. Francis. And I know you mentioned your wife had a lot to do with that. What compelled her to get you to St. Francis?
I was actually in the emergency room at
The South Side, correct?
Southside
Southside,
Hospital.
right.
Yes, Southside Hospital. And I saw my electrocardiologist from the group that I used to go to. And I called them and I said, can you please let them know that what's wrong with me is that I'm having heart failure and that I have too much fluid in my body. So he went to the front desk, notified them, and no one ever came. No one ever came. No one ever said anything. And when my wife questioned them, they said that they didn't know. No one even knew what was going on. And my wife said, "You know what? This is enough. And he spoke to my cousin, who's a PA, and he said, "Listen, get him to St. Francis as soon as possible. That's the only place they're going to keep."
Wow.
So between my cousin Bill Sierra, who was he used to be a PA at Good Samaritan for many, many years, and between him and my wife, they made the decision to transfer me to St. Francis and have St. Francis look at me and do whatever they had to do to keep me alive. And I thank God for it, because if it wasn't for that decision, I would not be here today.
Can you talk about, Jose, some of the things that you've been able to do again after your procedure at St. Francis?
I get yelled at because I do everything that I'm probably not supposed to do, like work under my car, just work in the backyard, the digging, the things that I've been doing is almost as good as it used to be before I got sick. I mean, it's close. I tend to get tired sometimes, but it's amazing that I can function the way that I am. I can drive. I can go walking with my dogs. I play with my grandkids, and that's a godsend because I got 14 of them, and one more is on the way. 15 will be here in about 4 months. So seeing my grandkids growing up and being able to play with them, and just, like I said yesterday, I was playing babysitter to 8 of them in my house. Yeah, my daughters needed to take care of some things, and I played babysitter. And what's good is my daughters, they tell my grandkids, if you don't behave, we're going to take you to grandpa. And you know how grandpa is. They're not afraid of me. What they are is respectful. which is something that you don't see very much today. But we've raised our kids and grandkids to be very respectful in life. So, you know, that's one of the major things that has just been wonderful for me, is that I'm able to watch my grandkids growing up, and hopefully I'll be around to watch hopefully half of them get married and have great grandkids.
That's fantastic. Thank you for sharing that, Jose. Dr. Germain, we have a question that coming in for you. You worked obviously with Jose. How typical of a patient was he, or was there anything that he required that was kind of special?
So as you probably know, we're what's called a destination LVAD center. What that means is that we don't do cardiac transplant on site. We work closely with Montefiore Medical Center for transplant. So the typical patient that comes to us that has heart failure is not coming here as a patient who's going to be listed for heart transplant or be evaluated for heart transplant on site. So patients like Jose, who were at other community hospitals and who are very sick and failing medical therapy, is the typical type of patient that we get here at St. Francis to be evaluated for things like a destination LVAD. What was a little bit atypical in Jose's case was that he had a breathing tube in when he came over here. So he wasn't able to actually communicate with us about what his wishes were and what he would want done. You know, in an ideal situation, we really like to see these patients in the office and get to know them before we talk to them about implanting a device in their body through open heart surgery. But in his case, and many, many patients that we've done in the past, patients are failing in other hospitals and they come over here as an emergency and get the device put in.
I'd like to chime in on two things. That's exactly right. The worst patient for LVAD, the sickest, normally it's called a category 1. And normally most institutions are somewhere around 13 or 14%. John, correct me if the numbers changed, but in the last several years, we've been way over 35%. Okay, so we are actually seeing a sicker population. And despite that, our results are amongst the very best in the country, by far. And Jose is another example how closely Dr. Germain, John, and the clinic follows people and how low our complication rates are. Jose's a perfect example that after you've had the pump and then don't have complications like driveline infections or strokes or all those things because of the great care they get, they end up living a life like Jose is, where he's having time with his grandkids and things like that. So as I said, it's an entire team, but Rita makes a very good point. We see the sickest of the sickest and nonetheless have been able to have some of the very best results in the country.
Dr. Lundy, I wanted to jump on something you said, and you've said it a couple of times. You've talked about team. Can you offer a little more detail on what you mean about your team?
We have embraced from the very beginning a multidisciplinary team that includes Dr. Germain, a cardiologist, John DiPietro, head coordinator, myself, the surgeon, social workers, nursing, dietitians, care managers, physical therapists, an entire team that rounds together. There's about 10 or 11 people every morning on rounds with all of these patients so that you get the expertise and care from an entire and it makes a huge difference because having one person look at you, you end up having 10 or 12 all with different expertises and all joining. The results have been crazy. Now I know that Dr. Petrosian in the heart valve clinic, and George, I'll let you jump in, has an identical approach that a multidisciplinary team. We all kind of know teams, individuals. Okay, they always do. I mean, the Super Bowl is a perfect example. A good team will always be and can provide better care. And so our team has already done it. George, you want to pipe in?
Yeah, I couldn't agree more. I mean, from the very beginning, we've adopted the same approach, with cardiothoracic surgery and cardiology, and involving non-invasive imaging, which is so critical for what we're doing in terms of assessment of patients, planning for patients, decision making about what treatment options are best, and then once that's done, just the procedure days involving anesthesia, nursing care, it's cath lab, OR staff. It really is truly a team effort. The PA staff caring for the patients before and after. So, we couldn't have accomplished what we've accomplished without buy-in on the team approach and the enthusiasm that each different discipline brings and experience for that matter. I mean, we as cardiologists have learned from cardiothoracic surgery, and I think they would say the same. Cardiothoracic surgery would say the same thing about what they've learned from us. So it's been a great experience for us. It's over a decade now of working on this. We treated our first TAVR patient in February of 2011. And before that, it was probably a year of planning. So we're in our second decade, and we're excited about where we're going and what's more to come. What more is to come?
Wonderful. Thank you. We're nearing the end, so I'd love to give our patients the final say. Angela, anything else you'd like to add as we wrap up our event here?
Did you hear me?
We're good.
I want to thank everybody. Like I said, from the doctors to the nurses, everybody that I was and met was just wonderful for me. And I felt that they really cared. I wasn't just a patient walking through. There was that caring that went through all this. And that to me meant more than anything else. I was very, very lucky. I have friends in the right places. Thank you. Thank you. God bless you all.
Jose, what would you like to say?
I'd like to thank St. Francis, the hospital itself, for putting together such great teams and keeping me alive, thank God. And I hope that in the future, when they get to develop something so I can go swimming, I'll be a candidate. I can't wait. I'm actually looking forward to it. But I'd like to thank everyone for all the work they've done and for all the research. And I pray that more people will pay attention to what's going on at St. Francis and go to you.
Thank you. And actually, we had another question come in that I'm going to go to the doctors with, and Dr. Germain, we'll just start with you. The question really surrounds care during the pandemic. And obviously, we're seeing some patients stay away. How do you get the message across that, the hospital environment is safe and they do need to come in for that treatment?
I'm so happy you brought this question up, Greg, because it's a really important point. Sorry, Jose, I didn't mean to cut you off.
No, go ahead.
So this has been a big area that we've been discussing this whole year. Don't wait to be evaluated for your heart. Our hospital is safe. People are safe. We've taken care of people this entire year who have had issues that are non-COVID and COVID related. And heart failure doesn't go away. Heart failure needs to be addressed, and it needs to be addressed in a timely fashion. And by delaying care, you could actually make yourself sicker.
Dr. Lundy, anything to add to that?
No, I voiced that, the studies are showing that the number of people that are not coming into the hospital is causing more deaths at home. People are staying home and getting heart attacks. In addition, what we're seeing is that people are coming in with their hearts completely damaged, okay, which if they just would have come in, wouldn't be the case. So it is safe in the hospital. There are a multitude of checks and balances to make sure. And if you're having a heart attack or you're having heart problems or heart failure, you need to come in. Okay? Waiting only makes it worse. George?
Yeah, I agree fully. I mean, it all comes down to risk benefit. I mean, one of the diseases that's the most well studied is aortic stenosis, and the mortality if you have symptoms and you don't get treated, and that mortality runs, I don't know, anywhere from 2 to 3%, or in the range of 2 to 3% per month. And then there's a gradation depending on how sick you are, if your heart's weak, and so on. So, if you delay treatment for 3 or 4 months, I mean, you're accepting almost 10% mortality risk. by deferring treatment. And certainly the risk of getting COVID in the hospital is a fraction of that. It's safer than going out in public. So I agree fully.